Good morning. I would like to welcome you all, to everyone here in this 120th webinar from the start of the distribution of the Andean Organization of Health that celebrate 50 years of uninterrupted working together with the ministries of health of the 6 member countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, aiming to guarantee the health of the population. I would like to share with you 2 key messages. The first one is the vaccination against COVID-19 is safe and effective to protect our population against this terrible disease. The higher the probability of vaccination, the lower the risk of getting the infection, especially of the severe cases. Make sure that you fulfill your vaccination scheme. There are no excuses. Always respect the other preventive measures. Second, climate change is threatening the life of our people, health and well-being. But as any crisis will be also considered an opportunity to improve. We need to raise our voice and behave, protecting our people and our planet. You can work with us, purchasing local products, using public transportation, bicycle and walking, reducing the consumption, reuse, recycle and repair, restore the relation with nature. Nature is health. It's essential to recognize the ancient knowledge of the original people that lived for so many years in balance with nature, trying to avoid exploiting nature and put into practice the the good living. We are the generation that will be able to make peace with nature, and we will open these virtual doors aiming to discuss about the health systems. How do we will the future health systems with equity? A vision from the Copenhagen Institute. I would like to invite you to leave your name, organization, and country in the box of Facebook Live. You can also leave your question to the webinars.orals.com. In this webinar, we will continue the following dynamic. We will start with the institutional salute. Later on, we will start with the presentation from Dr. Borgin, Director of the Copenhagen Institute for Future Systems, followed by the comments of Silvia Pesan and Camilo Sin, Director of the International Fund of CENASA Chile, and then we will have our active pause to move on to the space of questions and answers. To have access to the certificate of attendance, on any of the chats from the Facebook Live or YouTube Live, you will find a fixed link where you will have the possibility of filling a brief survey so you can fill your data to receive the certificate of attendance. Yeah, that you will receive through email. To start with this important session, I will leave the word to Mari Carmen Caidalna, the Executive Secretary of Orascono, that will give the invitation and the institutional salute. Please, Dr. Agay. Good morning, good afternoon, good evening, everyone. Welcome to this webinar 120 from this 2022, from the beginning of these presentations on May the 7th of 2020. As you may know, the Andean Organization of Health, the Hipólito Unanue Agreement from December 18 was celebrating 50 years of uninterrupted work with the 6 member states, Bolivia, Chile, Colombia, Ecuador, Peru. in Venezuela, promoting these spaces of interaction and learning. And due to the fact of the pandemic by COVID-19, and today that is a routine situation to analyze, share, and discuss information about public health issues with solid scientific evidence that will contribute to the decision making in the sub-Andean region. In this moment, we have more than 2 years of pandemic of COVID-19 with the evidence that was developed and the lessons learned in this time. And we wanted to analyze how do we build our systems, health systems with equity. Vision from the Copenhagen Institute for Future Study. And for that, we have the presence of Dr. Golia Eliassen, director of this institute, followed by the comments of Dr. Silvia Pesan, former Ministry of Health of Peru, and Dr. Camilo Cid, director of the CONASAN Chile. It's important to design that the health systems were put into test in terms of the capacity of response to serve the population and the medium, middle income countries and developing countries have to confront the situation of the COVID-19 challenge, requiring intensive care unit in the different waves of the pandemic from 2020 to this date. The first level of attention was reduced when the pandemic were evolving, and based on a report published in March of 2021, the saturation of public systems around the globe impede the access of medical attendants on other health situations different from COVID-19, both physical and mental. Currently, the efforts by the Ministries of Health of the world and mainly on the Andean community were aimed to recover the gap in the population that is served during the pandemic, and the pandemic is still going on. The crisis, the political crisis and health crisis is still active. We need to make from this situation an opportunity, insisting in every field where health should be a priority and recognized as a fundamental axis of development, maintaining as a priority on every policy. We should guarantee the access to health of the different members of the population. We have, of course, huge challenges to confront. Reason why we need to continue working coordinatedly in the different sectors at the different levels, aiming to obtain health systems that will guarantee the exercise of rights, prioritizing the expectations and needs of the population, a new training in sciences, considering the transdisciplinary approach, the social dimension, the community dimension, promoting the health sovereignty to strengthen research, promoting and generating scientific evidence in the decision-making process, to recognize the importance of the telemedicine and telework or everything related to the technology advances, to emphasize the work in promotion of health and preventing diseases, including the social determinants of health among different aspects that we should take into account. Last but not least, I would like to manifest that during this time we were learning a lot of lessons that we need to make tangible to build health systems that are sustainable, resilient, reaching a better quality of life and well-being along the entire course of life, and of course, get the social justice and environmental justice. I would like to repeat my deepest appreciation to our excellent speakers, Dr. Goya, Dr. Pesa, Dr. Sil, and all of our participants from different countries of the globe, Latin America and other countries, that week after week are joining us. Thank you. After this institutional salute, my name is Marisela Malki. I am a physician, actually the Joint Secretary of Arascon, and I am in charge of the moderation of this seminar. After this introduction, I would like to give you a warm welcome and Dr. Goji Lansing, Director of Health of Copenhagen Institute for Future Studies. He was born in the Faroe Island, educated in political sciences from the Aarhus University in Denmark, where he received a master's degree in both fields after receiving a training in executive business school from Harvard Business School. And after that, he worked in the External Affairs Ministry in his country and worked as a consultant during the last 20 years for politicians and public sectors. He started the first project of population genome to make a sequencing of the Faroe Island. He received the Global Prize H&Y Future 50 by his work in 2019. He started the Nordic Trail 2030. He has a key role to play both in the future profit health and the movement Health 2030 as a global leader as a public policy who aspired to improve the oral general health, changing the paradigm of health. He's a co-president of the Science Leader Network in Europe and chairman in Denmark from the Association of Bioethics. As a director of health, Dr. Goji has a holistic view about the future of tailor-made health centered in data, digital functions, and genome, and the integration about health that was presented in different projects and networks in which he was involved. Welcome, Dr. Goji. This is your space. Thank you for joining us. Thank you so much, and thanks for the opportunity of participating with you today. First of all, I would like to say that this is an extremely important organization that you are leading, the one that you are leading here, and I will really appreciate the work that you have done, especially with the webinars that were conducted during the last couple of years, helping us to understand better the evidence around especially the pandemic. For me, this is an extremely good opportunity to talk about this topic that are interested in a change that couldn't be by an isolated individual, but we can give some contribution into this effort. And I would like to share this presentation into the view that will share with you the vision of how to share health with others for the future. I might say that I have it's not in Spanish, but a Porto Spanish. I live a couple of years in Brazil, and I get married with a Peruvian girl, so I feel myself like a Latin individual, a little Peruvian, and of course, I am quite acquainted of Latin America. So I will share my screen with you. Let me know if you can see it. Yes. Okay. How can we build the future in the health system with equity? When we talk about the future, it's important to remember that our knowledge and experience is based in the past, and the decision making is a process for the future. So it sounds simple, but when we make decisions to change, of course, we need to learn from the past, but the work from the future is not the same. So we have to admit and work towards that future, that unknown future. We have been working a lot with different projects and ideas, concepts within countries. One of them was the Nordic Health and how to work together with data, with digital tools and genomic in Nordic countries. And later on, we push some concepts on how to look into the future that will go beyond politics. How can we aspire to move away the right wing or left wing policies, but open the field to work together, not having a consensus, of course, in every single detail, but we can have the same north. And for us, health is a global priority. It's not something that we can just establish in one country. And if we analyze what is going on now, why do we have problems and different issues with health? We witness a huge increase in the burden of disease, at least before the pandemic. We had some years, life expectancy, but a lot of diseases present. That's why we will not be able to continue working without burden of disease in the system. We see that we have, of course, disease by accidents, poverty, or contagious diseases that are also there present, and also the violence is another factor to consider. And of course, the systems might have an approach to treat the disease instead of promoting health. And there we will say that if we think what happens 150 years ago, we have hospitals that instead of hospitals were dead houses, and some people could survive and others didn't, but we didn't know why. And then we moved to the house of diseases. When you reach or you arrive to this area, and you can have some strategies to reduce the speed of the condition. And the idea is to have in the future houses of health to maintain the people healthy. With a chronic disease, we can see that the left side is where we should be thinking or using our energy to implement strategies with low costs, introducing different tools to maintain the health. But unfortunately, all the systems or the vast majority of systems are just starting to work when the disease is already quite advanced. So we have a higher cost with the intervention, and it's a least efficient strategy with a lesser impact of these strategies, not as high as we will need it, because we are arriving too late to treat this condition. And we see how many studies show that the prevention is getting some attention, and the benefits for health in other environments will have an impact. 70% outside the clinical setting having effects on the health of the individual. If we look to the genome site, this is a technology that we have from our lack of knowledge. Something that is already available for us. So it's not an opinion if we should work together or not, but the fact that we have 10,000 monogenic diseases, rare diseases that maybe we will be able to work with that with genetics. Same time, even though that we can consider them rare diseases, each country has between 7 to 10% of the disease burden. So it's not that simple to approach to this problem. And of course, we will push genetics in that direction to solve this issue. We know that also that virology is also quite advanced, because now we have epigenomics to analyze the effects of the environment. We have more proteins, more metabolomics that are also there, and we should work that on the clinical setting. And that's why that's an area that we need to think about. How can we develop an infrastructure and train our human resource? And one of the reasons why COVID hit us so hard was because this area in Latin America was not well developed. And that's why it was so difficult to work with COVID, with tests, to recognize what type of COVID was around our countries. It's important to recognize that some data come from different formats. We're working a lot with billboard data, not only data that came from the lab, but also data from the society that we can use to collect evidence from the field, but we're also working with more precision. So this is the evidence in personalized health or tailor-made medicine that, for instance, is something that we see in cancer that is treated quite precisely. And we can also use data or the increment of the information about genomics and biologics to have better structures of public health. And we are also keeping in mind the reason why we need to improve our health systems. And for us, this is translated into a better quality of life, extending the life expectation. Our goal is not having a health system that is super optimized per se. We can see that, for instance, the Denmark health system is quite more developed than the one in Spain, but the Spanish live more years because we have other parts of the society that will have other factors that contribute to the quality of life. So that's something that we need to prioritize. What we need, health or the health system? And this is a mixture or a combination between these factors. So when we think about more reasonably, we have many concepts. We have international treaties. For you, this POW is extremely important, but concepts as health in different policies is already there in like the last 20 years. The health determinants of health, it's important to consider that a health where we can put together the health of the planet and the health of the individuals, and also the well-being economy. In many countries are trying to create policies to connect those areas or those concepts that were already launched a couple of years ago, a couple of decades ago, but it's also now time to have health as an investment, but also as an important column on our society to guarantee the economical development. Because if we have a population with a very strong health, we can also grow economically. There are also changes. The new stakeholders in health are not only the companies that might work with health today, as the technology of health, as pharmaceutical industries, the big companies of big data or digital tools are getting very quickly into the health domain, especially in China and California in the United States. And this will, of course, affect how can we work with help opening the doors on the data that we can use. For instance, data of behavior that might be located in different forms. And I see as well that when we have a discussion, if we can have access to the internet or not, if you can open a Facebook, if we are going to be able to have access to the health services in this format, in the digital version. Another change that will arrive very quickly is the genomic will be reduced to $100. It is much affordable than making a CT scan, but putting together the data from one individual to other or the behavior of this individual, there are many companies that are allowing you to do that with $100. And if you are able to put together the behavior with the biological data, you can open an opportunity space that you don't even have the chance of understanding, combining. That's why we need to have an agreement between the countries and what we need to obtain. That's how we will implement those strategies for the well-being of each individual and also for each society. If we look this approach, we see that there's a well-being concept over the life expectancy, talking about the duration of health instead of duration of life. Having a life with health, at least in the vast majority of the life, not only have a long life, but a quality life, having an attention or a healthcare system centered into the patient, and having value as one of the domains with a tailor-made attention, orientate our attention or our efforts towards prevention. One of the agreements that we have in the Nordic countries is the aspiration of the 50-50, and this is a model that all the budgets orientated to health, around 97% will be orientated to the traditional treatment, and only 3% will go to prevention. And the operation that was able to be done with the experts, with the decision makers, will allow us to think how can we distribute this in a proper manner, not only a primary prevention, but also secondary and third prevention that we have here. The vast majority of you probably are located in the secondary prevention. Another principle that was developed was the 1090, because almost everything that we develop for the health system today is made for the 10% of the richest members of the world. And there's how we take conversation with organizations, with companies, pushing the limits, pushing the envelope, and to evaluate how can we implement this for the rest of the world. And the principle 2080 that is just recently implemented. I don't know if you have that information in North America, but if we can see in Northern Europe, we see that every day we have 20% of individuals that will need some type of health service, and 80% are still healthy. So if we can pay attention to this 80% healthier with few resources for more time, maybe we can have more resources available for the ones that are constantly sick. And this is something that we might add value to the system. This is another alternative to create social value while we are helping at the same time. So I would like to move to a different direction, showing you a very busy slide. Working with Europe, we developed some health data framework to determine how this concept of the humanome will have access and control of the data. And if we need these individuals to receive the capacity of taking care of themselves, we can also give better access to data that is validated, not only a piece of information that will not be useful. And we're talking about social factors, biological factors, behavioral factors, and environmental factors. And these are data that are already available. It's not a question of doing something that is not already there, but thinking how can we connect those data in a conscious manner with dignity that might support to the citizen, to the individual, to use those information on their own good. But of course, we cannot do that without working with the health systems with that data available. If we want to accomplish that dream that we listened in the vast majority of countries of guaranteeing health for all, we will need reliable data sources. Thinking about the individual and not only improving the system. And this is something that we need to think differently. Who has the responsibility of doing so, working with that? It's not only a matter of the political sector that will need to provide this to the societies. We need to have a corporative responsibility where we will have more responsibility to develop each case, the civil society, from the public sector, but also from the individual. So we can work together in that development for the future. The vast majority of countries, we see a lot of imbalance in the public sector, and they say that the public sector is the one that will solve the problems. I don't think that that approach is true, because we have to make a joint effort, and that's why the future is also calling for the collaboration for different sectors or different organizations, different professional groups, and there to make a decision-making process being transparent enough. And we will work with different contacts, and we will have some risks, of course, and taking into account the traceability, responsibility of the future generation. And this is a right that needs to be taken into account before putting digital systems, because the digital tools are just tools. They will not resolve the problem if we don't have an idea on why do we need to keep that information with us. And just to take as an example, we will use 200 of years to develop the human rights for the individual. And this was also an aiming to protect the individual from the governments, from the organizations, and from the criminals. This is not something that we are doing with data. The discussion about data security might be orientated to protect data, protect people. And here is where that area is developed in Latin America. And here we have the a golden opportunity to redefine how we are going to work with digital health. We have 500,000, 500 million Spanish speaking. There's a huge area where we can go to look for an ability and define what is digital health for the future. And of course, the health literacy is extremely important, and this is a gap that we see in the entire world. It's also very big in Latin America, and defined as the capacity of people to have access and apply information in the decision-making process in a daily basis. This is also applied into the health professional. When new technology came, we also need the capacity to use it properly. One action that we said in the Nordic countries was to develop or work with 5 values that we use as cornerstones to work. They wouldn't be the same values in the different regions of the world, but at least I would like to share this example with you to show how important it is to have values where we could sustain our work to the future, because technology changes a lot. If we only put the collaboration of technology, we will lose that collaboration when technology evolves. In the Nordic countries, we have a lot of trust, moderation, responsibility, individual and community responsibility, openness, and creativity and innovation. Of course, those are domains that need to put into account, and especially to put us this example in the Nordic countries, that relation with their Nordic values. And when we try to to inculcate these values, it was very hard work to spread this information and make everyone aware of these domains. Another project that is interesting in Latin America is the Movement of Health 2030 in 4 pillars, improving the access of healthcare attention. That's the primary care setting with lack of technology, but at least having some basic elements. Improving the access to technology, data science, data around science, and new models of sustainable health. Of course, the economy of health. How can we present the incentives to make it possible? How are we going to work for the future with the new players that come into the market? How we push more value to health? And also, these are our pillars that we work from the institute. The importance here is that we need to develop these areas one by one, but also connect them because they are somehow interconnected. We are going to be unable to develop a health technology if we don't have part of these four areas. And of course, I would like to put into account of the models of business because the health economy is not a question of making a health sector more affordable or cheaper, but is a question to evaluate if the investment on the health budget will give value to our citizens and our societies. It's an investment, so to speak. And we are going to be able to work with these ways of investment in health if we don't see the budget as if we continue seeing that as a cost and not as an investment without having data. That's why it's so important to have new ways of managing data and the bioscience of working with pharmacogenomic will be extremely important to have more security in the system. But otherwise, we are not going to be able to have a better primary health. And we are not going to be able to escalate our services for those who will need it the most. And the primary healthcare is something that we start to think in Latin America, but we are now pushing in the whole planet. How can we obtain technology that is already working, that is already there, is available in a vast manner? For example, in pharmacogenomics, we have a test that we were able to do in Latin America where we can apply to 500 million individuals, and that's completely possible. So if we think in the long term, along the continent, we have several options to work with this, and the idea is to work with this approach, getting very early into the circle, so we could have an early detection and early intervention, and also prevention. And with the bioscience, we also see how it happens with cancer, and we will be able also to identify and detect more precise strategies, with more precise strategies, early diseases. Many of these treatments are not expensive, and actually, if we think about the health systems and the precision of these health systems, we can be much more precise with the diagnosis, early treatments, and maybe will not be more expensive. When we talk about telemedicine and telehealth, this will be something that will be quite present in the agenda with COVID, but we still need a lot to evolve to apply these strategies to the vast majorities for people and clinics. And we have, of course, a gap. We have a huge challenge. The idea of digital health and telehealth was to provide better services, and that's something that generates a lot of burnout in the health professionals. We need to think how can we use these elements and the health economy to rethink and push these processes in Latin America, the possibility of investing not only in strategies but in the people, the well-being of our communities, and that's something that could be done. The economy is not a cost but an investment. And also what we see is that we have a hyper specialization and holistic, rational. We need tailor-made connecting the different elements of these strategies. We will have population with a lot of chronic diseases at the same time. And at the same time, we can become very precise. And taking the words of Soichiro Honda, vision without action is a dream. Action without vision, it's a nightmare. And of course, the vast majority of countries are not having that vision, but they have a lot of action. So the nightmare is there. And when we work with these elements or with these parts, it's super important to have that approach to prepare our societies and to prepare our technologies. But because it wouldn't be possible to push new technologies with these new concepts if we don't have a generation to work with them. The failures we have were not due to the concept or the technology that didn't work, but due to the fact that hearing of the technologies and the people that will manage that technology was not there. This is something that we have to keep in mind and a very important concept. Something that happens a lot in this area in particular is the fact that in the Canada School we use a lot of this model, this difference between a technological change and an adaptative change. Technological change is when you wanted to apply something that is already there. That's extremely important. When you have a blueprint, you know what to do. And it's quite simplistic because you go from A to B and you know how to do it. But the adaptive change is a transformative one. How can we include a different disruptive thinking? We need to do things completely different, but when it happens, when the things go wrong, our toolboxes, our tools that we have are available and we just follow the trend of the technological change. And this is what we call work avoidance. And we are working like crazy, but we don't see any results because we are doing the job with the improper tools. We're using the tools for technological change for the adaptive change. And that's one of the main differences when we talk about the hyper specialization of the health personnel, trying to change the system more holistically instead of just changing the people. And that's something that we fail a lot. Another concept that is extremely important is the resilience. How can we adapt our systems into a more equitative, with more solidarity, but with resilience? This is a study that we conducted some years ago, 6 years actually, having three segments. How do we see the future? We have the innovation and we have the risk management element. The vast majority of stakeholders are working with 90% of their resources towards the risk management. But if you only do that, we are not going to be able to be prepared for the future, and you don't have the energy to innovate. A resilient system needs to distribute or create a balance between these three elements, not only putting all our efforts in one single item. And the most challenging area here is that we need to think before looking for answers. If we are only looking for answers before asking, we are looking for answers into a system that is already broken. And we know that this is not work. This is not something that works. I could also say that technology for a better health is already available. We already have it. We need the determination. But we need to prioritize and to apply them, to apply those concepts, to take those decisions where we need it the most. And there's how we will reply. I see a field of a lot of opportunities in Latin America. Yes, we have some issues. Yes, we have people that are not having access to help, but we see that there's a need and a willingness, and of course, people that have the capacity to rise and to contribute to these efforts. I would like to repeat that when we have 500 million people with the same language, you can connect with each other and escalate the effort, something that is very difficult to do in other parts of the globe. So here I would like to ask to you and collaborate as policymakers, thinking always what can we do for 2030, 2050, but also what can we do for tomorrow? What can we start immediately tomorrow? And I see a lot of willingness, and I think that the success of this webinar will show that we have a lot of willingness to push this forward and also putting that extremely clear, working together among different sectors, among different disciplines, and between countries to work together for the future. Thank you, Dr. Goji, for that fantastic presentation. You show us a vision on how to access health, how to build for the future these health systems with equity. We are still having an approach on health without intervening with the risk is low, and we have an important impact and a lower cost. And when the disease is delayed and high costs, and we see that there's an important rate of investment in prevention and treatment, having the vast of investment in the treatment instead of investing in prevention. We wanted to obtain a better quality of life and well-being, having more health during the longer part of our life. We have, of course, different agreements, concepts, such as health for all in the ODS, in the determinants of health, the concept of health that was emphasized during the last couple of years, the economy of well-being. We talk about the possibility of making democratic the health, like genome will generate huge spaces for opportunities. We will have new areas, the proper approach, and the aspiration is that on everything that we are putting our money, 50% health and 50% towards treatment. We have this trend that we are working for the 10% of the richest, and we will try to maintain the 80% of the population healthy so we can have the possibility of improving the access and possibility of having a data control. It's a new concept in order to validate these approaches with responsibility that should not only be corporative and public, but also from the individual. And this is the last element that we were talking about based on the pandemic situation. There's a lot of movements of health towards the 2030 to improve the access to health and quality health, improving the science and biotechnology, the data science and solutions, models for sustainable health. So we need health that is connected with a mystic health of systems. And of course, the call to action is to analyze the future and to say what can we do in the long term, and as we can say in the Andean Organization of Health, in an interdisciplinary or multisectorial approach in the different levels. I would like to thank you again, Dr. Goji, for the wonderful presentation. And we will continue with our webinar to start in a few minutes. Now we will move to the comments segment, and that's why I would like to invite Dr. Silvia Pesa Haidt, former Ministry of Health. She was Minister of Health from 2013 to 2019, and she was a Vice Ministry of Public Health in the same ministry in the last couple of decades. She was a high-level consultant in public health policies, including the medical research for the Quality Improvement Program of the Health Department of Israel. She is a physician from the University of La Plata in Argentina with a master's degree of the University Cayetano Heredia and a master's degree in biomedicine, informatics in the health in the from Washington University. And she also received a training from the Medical Association Israel approving the residency of public health. Isla Aleph. So at the beginning of the public health approaches, she worked as primary attendance as assistential physician in the periphery area of Lima, having associate approach, and she developed different projects related to public health. Later on, she was the chief of the epidemiological department from the National Hospital Cayetano Heredia, and later she moved to the direction of the Biological Products Center in the National Institute of Health. In 2011, she was a medical researcher of the program of quality guarantee of hospital quality of the Ministry of Health of Israel towards 2013, where she became part of the team of the epidemiology department from the same ministry. After on, she returned to Peru. She has several researches published in middle and low-income countries, working with multilateral companies and institutions, working with successfully with multi-central approaches, with working with public and private sectors. Welcome, Dr. Silvia. Thank you, Marisela. Thank you, Mari Carmen. It's a pleasure to have you. Goyi, it was a pleasure to listen to your presentation. And it was a pleasure to have the presence of CEPAL individuals here. So we listened to several ideas, and also I would like to mention that it was something that I wrote down to congratulate the nurses on their day, to remind you the day of International Day of Nurses with their noble job. I would like to congratulate you. I always say that I wanted to recall a phrase from Seneca that said that to accomplish your objective, we need to eliminate two things: the fear for the future and the remember of a bad past. And a recall of a bad past has already affected us. So we need to look to the future. That being said, I would like to remind you that we are in a quite interesting situation in the region. Last year, we had elections, presidential elections, and also from the congressmen from different parts of the region. And now comes the election time from Brazil and Colombia. We already went through elections, so we have a changing scenario, an important moment that we can take for an opportunity. In a recent webinar from the World Commerce of Contract, said in a forum of 74,000 individuals, said, look at the glass, and not only looking at the glass half empty or half full, look to the glass in the way you wanted to use it. And we intensify a process of construction of policies, regulations, tools, strategies, all destined to transform the health of Peru. In February 2019, Mari Carmen might recall it, during the presidency of Dolores, it was approved a credit of $300 million to the implementation of the integrated networks. They will say it's the first seed. It is the most important element. One of the sectors that was least evolved in the Peru. And we made some efforts to implement what we developed even independently from the pandemic. And what we need to do is to say is that the pandemic make evident our deficiencies. But how about not looking at them as a differences or deficiencies, and to instead of seeing the difficulties, we can look for the opportunities. And I say that because we have more demands due to the COVID and was evident to the entire region only in Peru. There are some demands to improve the health services, and I'm talking about all the services, not only health. I'm talking about water, sanitation, internet connectivity. I'm talking about education, and of course, health. And of course, we'll look for more health and security. And of course, in a certain manner, we might have a here demand because we have within our countries a huge public debt and an inflationary pressure that is quite important. And over that, we have to work on these issues, especially in health, and how to transform what we already have. I will say that here in Peru, at least to have an amalgam in the health system and this to move forward, I will say, and this is a very personal opinion, that has to be a tripod, having the head of the Ministry of Health, the head of the Ministry of Economy, and the executive power need to be committed, a real commitment, not only in topics of health, but also what you already said, health for everyone and for every policy. And in this country, we need to be honest, and we don't see a real commitment. And as I said, we need to look into these differences, not only look into the difficulties, but also searching solutions for everyone here. This is an opportunity, an extremely interesting opportunity for all of us. And we have the possibility of going beyond this. This is a moment where we will have an opportunity to the regions and the local governments. Now, in October 2022, we will have an important opportunity with the municipal governments and the regional governments to promote from their own land the transformation on the health that we already need. And we don't need to be selfish. Dr. Carbone, former Ministry of Health and former MINSA's consultant, produced a very interesting document that I invite you to review and share. It's called Transformation of the Health System of Peru, and it gives a very short relation, but quite efficient, of every single point that we need to put into the table together so we could reach that efficiency of the system. In document, I might say that we have some municipal proposals that need to be to take into account with very briefly stated objectives. And when we talk about innovation, it's of course valid to talk about transformation. This is something that needs to be respected and valued by the population. What about if I say that we need a map, a roadmap, not a document with hundreds of pages, but a starting point, territorial diagnosis. That's something that we already have in the ministry. We have been working with a lot of these items. So we will identify the health determinants of health that will affect us and affect the burden of disease. And for every region is different. Some, as Dr. Boy said, are overcome. We will see what are the specific goals. We will add activities by results, costs, responsibilities, raw materials, specific strategy, because I'm sure that every single one of you will have a different strategy. How about we put a schedule, a logic sequence, monitoring strategies, evaluation, and budget. And this is how we translate that information to the local formats that are quite complex and inconvenient, but we can do it from the municipal or local governments, and we might apply some technical international cooperation. I would like to invite you all to start working. If we are unable to do it in a macro strategy, we can do it at a regional level. We are able to do it. We are in the proper moment, and I think that this will be a fundamental moment to do it, to make it happen. And I know that you might have the policies of the norms and the tools. And of course, I will like to say to you that the vast majority of them are already there, already written down. We have some things to change. Yes, we need to change some things, but it's important to remind that we will have two important policies. And when I listen to Boric say, let's imitate the Nordic system for the 2030, this is something that I already heard 20 years ago. We can create a very simple document to follow the guidelines and multi-sectoral approach for a health policy for 2030 and for the 2050. And for a country, we already have a national policy that is called Peru Healthy Country. And here you have the policy of universal health coverage, that is the CUS. I don't know who was the one who came up with this name, but we have those plans of ensuring health and complementary plans with cost estimation. So we have everything for the health transformation. And later on, we can discuss about the modification of the system or not, and we can start with some guidelines, and we have complementarily the electronic clinical records. We have one way or the other an articulated project that is the PEREIS, the integrated networks of health, the reference and control reference systems in the government are working very strongly with the SAMU. So we have different instruments that we can use. I wouldn't like to overextend, but it's important to recognize that this of creating a health system is only possible, as Goji said, about the health literacy. And I might say that is the recognition of the importance of the health. If we as a society will value our society, this will be the only way of our authorities follow those steps. And I cover many topics that I think that are at national level, but actually are Latin American guidelines and actually of international applicability. The access of continuity of the services, and Georgie tell us that the tripod, one of the legs might guarantee this access. On the other hand, we have science and digital solutions. We need to recognize some small changes in the country, and there are some countries in the region that were ahead of us. We need to say with some envy that Colombia is more advanced in terms of digitalization and access to electronic services. It's not of a better network to internet, but in the Sumbingma That is a similar system of the decommit. We can guarantee the digital services access, having a differentiated service. We cannot have a decommit that will compare one electrocardiogram with a system, a digital system. So those are the modifications that we might promote, identifying them. And we have a serious issue with the legislation of contracts of the government. When we see these 180 visions in relation to the partnership or the associations, both public-private associations and with the post-graduation programs, and not only related to the state purchasing, but because in the country we have a lot of problems of communication. The private sector could not communicate with the public sector. The private could not communicate with the private sector. In that detail, that is not a small detail for those who have some experience in the health sector, made us generate some issues because we were going to be unable to have, as Europe has that right now, the access to cooperation or to support the digital services or to have one horizontal relationship for having access to the new technologies around cancer. That's extremely important. This is happening right now in Europe, and the big pharmaceutical companies have stated to improve the country plan that is not happening in Latin America. This is something that we should add, especially in Peru. And I put the example of Peru because I have been working in public policies in this country, and that's a model that is not available here. Can be worked as with FISAI, with a fund of high-risk pathologies. And this should be an intangible fund that is available in Colombia, Ecuador, and other countries of the region. So this is an important point to treat rare diseases, oncological diseases, that right now many of them are treatable, but are not treated in the country. Innovation is not a matter of having access that was shown by the system of Goji. Talking about the collaboration with the Ministry of Cooperation and Science, this is something extremely irrelevant. It doesn't matter which one is the engine to reach innovation. Innovation per se should be sustainable, approved, and designed so our young ones that are witnessing these changes in the other parts of the globe are young ones that are working with innovation and technology supported by the government, and they are able to develop different domains of this innovation that is walking towards a spectacular adaptation. And just a couple of words for policies and opportunities. We need to recognize that we have different policies with some public health determinants. And with some concern, I have seen these policies of one world, one health that was quite recognized in 2006 or 2009 was transformed into other strategies. And now we are talking about the green health, like it's a more integrative approach, that everything integrated with the objectives of sustainable development. And I think that something's missing. And of course, as Goji said, it's not only an additional leg to our table, but will be an additional step or a fifth leg talking about accountability. If we are completely transparent and we are ethical, people will trust us. And I say to you that are on the other side, you are now policymakers, and we have that fifth leg that we will call as an accountability with ethics and trust. People might trust us. Regional government will be able to work properly. We won't have so many issues with what we do or what we don't, but we will have the possibility to incorporate an ethical policy in health, having equity in our health approaches. I would like to open the Q&A session, and now I finish my intervention, thanking you for the invitation to this seminar and debate. Thank you so much, Dr. Silvia Pesa. Very optimistically, you talk about taking advantage of the situation we are in, working on this crisis, looking at it as an opportunity, how to transform health and how to maintain the health of our population and every single policy. You talk about the involvement of the high level of decision making of the President, Ministry of Health, and Ministry of Economy, so we can move forward into what the future comes to us, and starting from a single roadmap with a territorial sector. And that's something that is available in different parts of the country in different moments. And the characteristics or situations that were analyzed to have some extensions of the Andean regions with so many difficulties, and adding some important element that is the accountability and the transparency with ethics. So the population might have trust in our authorities. Thank you so much, Doctor. Please join us in the next session, and we would like to use this time to congratulate and salute everybody that is joining us in the ministries of health from different the Ministry of Health of Argentina, the Ministry of Health of Chile, some members of the University Pedro Rigallo, the Division of Health of Cuba, and extend my salute to different Andean countries: Mexico, Cuba, Spain, Paraguay, Argentina. We will move to the comments area, and we will move now to the next session with Dr. Camilo Sin, Director. He was official officer of social affairs of this organization. He was fostering as an economist, master by the Georgetown University, and PhD in economy by the University of Duisburg-Essen in Germany. He was the regional consultant in financial approaches from the PAHO in Senate in Washington, D.C., and during the last couple of decades, he was designated in different public health care areas and educational domains. He was designated as the Catholic University of Chile and designated as the president of the commission that presented a reform on the health system of Chile in 2014. Previously, he was designated in different positions in the public sector and direction of the Department of Studies in the Ministry of Health as a senior economist in the superintendence of Dr. Sid. He was a consultant by different international organizations in different countries of the region with several publications, public policies, and especially in different health strategies approach from the economical view. Dr. Camilo, your microphone is yours. Thank you so much, Marisela. Thanks to the other participants and all the people that are hearing us. And I would like to thank the participation of Dr. Williamson. I think it was a Really nice presentation, opening the mind, inviting us to think. And wouldn't like to talk about Chile or FONASA, but to connect this experience with the comment of Vogi. It's an important aspect for the Latin American region, for our countries, and of course, this reflection about the common aspects, being a specialist in economy and health. Unfortunately, there's not enough data connecting biology and economical concepts, and there are some common points or common aspects between the traditional view that we might have to develop a health policy to refer later on to the opportunity and also the questions that came after jumping some steps after this particular trajectory towards a improved health system. So based on this context, the region are always put into evidence after a crisis, a pandemic. This one that didn't finish, going through this phase of variants of the virus, and hopefully with the success of vaccination, having a close to 70% vaccination rate, it's possible to imagine some new waves coming. It's the reality that we confront, and even though that we have vaccination, you like to take into account that here in Santiago, there's a new wave that we hope that will be a less severe wave that it started from a couple of weeks. We are introducing some control measurements. This is a pandemic that generate an economic crisis that was already seen a couple of decades ago, putting a country that after an important economical recovery, it was a statistical rebound. Now we have a slow economical growth that we hope will be extended for some years, might generate, as it was mentioned before, great debts in the public policies, by the public policies, avoiding us to attract investments in health. And here I go to the next element. Maybe it's important to mention that the health systems were already confronting several problems with a segmented departments with limitation in the human resources and also the economical resource or limits of capital access, install capacity that was unable to respond to the crisis, and we started witnessing the possibilities, seeing the mortality rates. If we compare Latin America with other countries, the mortality rates are higher here. And even though we see the most damaged countries would not have the impact that was such as Latin America had or suffered. So that context, what are the common aspects? I think that the first coincidence that was strengthen the health vision for as an opportunity for development. the centrality of the health in the terms of without having health, we don't have economy, we don't have economical growth. We need to explain those principles because we have ergonometric studies that show that if you don't have and we have health, we have economical growth, and under any logic, it's a common sense of humanity and for the region as well. Without health, we don't have possibilities of development. So I think that this concept will open an opportunity space. It's also an opportunity how easy, how ductible, how much opportunities we have in terms of incorporation of technologies as a response, both in the data management, something that was not available before, creating systems for the monitoring strategies, for processing the tests, for knowing the health activities, and in general terms, to the access of health through telemedicine and other formulas or tools that were rapidly adopted and generalized. So we have like a technological incorporation. And that's a possibility of incorporating new technology and data analysis in the health attention, but as we show inequalities and lacks of the equality distribution, there's also this inequalities in the distribution of health. So that aspect that we mentioned today, that call for democratization as opportunity to generate equity in the distribution of technology. So it's maybe not a case of talking about the types of technology available. It happens with the access of vaccination, the technology available during the first during the first months of the pandemic. The most developed countries concentrate the vast majority of access to vaccination. In Latin America, only have some more limited access, and took time for availability. We failed in terms of availability and distribution in the solidarity mechanisms because we have an interest of saturating the market, putting first the needs of the developed countries instead of distributing the vaccines in a more with more equality. And that's why it's so important to democratize. Of course, we share that approach of having a diagnosis that is mainly oriented to disease instead of health. And now we have some consideration on the health of different policies, the consideration on the health determinants of health. And I will concentrate my attention in the primary health care instead of a physical device, having primary health as a strategy. It was not well distributed or applied. It's difficult to find a country where a primary healthcare attention is well distributed. Not only having primary care health is offices or spaces, but the approach, not the curative approach, but preventive in reducing the need of other resources in the treatment of the disease. And that's an important part. In the region, there are some countries that put as a goal that 30% of the budget go to health. I think that no country have accomplished that. Maybe some of them reach the 25% because there's also some variabilities in the measurement techniques. But for example, Chile was unable to do it. We're always around 15 to 20%. It was one of the countries that established that objective. Costa Rica was among 20 to 25% for the ones that invested the most in primary care, but was not completely available in that level. I think that it's important within the coincidences to have a vision that is based on values, even though those values are variable. Here in the region, for instance, the access to health, solidarity, and equality are fundamental values. Some of us might agree, but in general terms, this is something that all because we are talking about tools that are into service of some health systems or health policies that might have a platform or might be supported in values that might be different but have the same sense, guiding the inclusion or integration of these tools, trying to have better access to people and communities. Another element that is specific in terms of the capacity of access to information, designating efforts in a better way, is extremely relevant. Many years ago, we say how the public health systems work. And when we discover this health system and we see the data, for example, the data on expenses related to people, and we say here in Chile, when you escape from the surgical intervention, a few years ago, we evolved having people with health events, and you might have access to that concept of the clinical access into the data center, into the individual, and not the strategies that we do. This is quite relevant. And we discover these approaches, we might discover that 5% of the population, 5% of the population consume more than 50% of the resources in health. And this is a fact that was already discovered in different countries. So we have that dream as a policymaker that you are able to identify that 5%, you might control the expenses. It's of course a dream come true because this is something that is already there. And what we need to do is to turn the system into a preventive strategy to have a response in primary health. However, we have space to do some descriptions, to have a redesignation of the resources, and will allow us to have, as Dr. Atesa said, have some catastrophic expenses with programs that were quite effective. Here we have, of course, effective programs to identify them. At least we are able to solve these issues. These catastrophic problems are still taking place. We need to find strategies, approaches, transition policies, having an approach on the high expenses, trying to find the common paths. I just mentioned some points because the presentation was quite detailed, but I would like to say, to concentrate in the following question: what are the steps that we can put away? Maybe putting as a model the Scandinavian systems or the English system or the Spanish system that made this evolution, this jump into the next level, the well-being. And that image of improvement of the health system will allow us to incorporate those concepts, improving not only by improvement the financing, but changing the strategies. During the 70s, were quite concentrated in primary healthcare. It doesn't look like something extremely important, the technology, because in that time, maybe those scientific revolutions were not that accelerated as the ones we witness today. So we might imagine that if we conduct that investment parallel to the system transformation, we will be able to jump some steps. That will be the question that I will say to myself. I try to answer because this might be or is actually the incorporation of technology is extremely strong in the reality. And I will say that based on the pandemic and the moderation of the new topics, it's basically specific in the inclusions with ups and downs, with democratic approaches in some of the countries, that it's important to ask how can we accelerate those changes into a better health service that will have a relation with people, and we will not invest in ecosystems or systems but into the improvement on the quality of life, as the presentation from the beginning stated, for the communities, for people, not only enlarging the life, but also the quality of life. So how can we take advantage of those strategies in the process of transformation to incorporate it before not thinking about something abstract that will happen someday and will fall from the sky? And I suspect that we need a lot of training, education, the different policymakers, the ones who are involved in the states, promoting the reform, and of course, the democratization of this progress to incorporate it in the formulation of policies. Thank you for your patience. Thank you, Dr. Camilo, for your intervention. You manifest the coincidences that we have with the vision of how to build efficient health systems for the future that will respond to the emergencies that we are dealing with. So I will start with some questions to Dr. Silvia. We know that the time is quite limited to working with us, and then we will move to the other speakers. We have a couple of questions for you, Dr. Silvia. What is the role of the health professionals in the territorial transformation of the health? And can you give some examples of territorial significant transformation? Well, the health staff, I think, is the most important resource we have, is our force, not only our workforce, but also the transformation force. Is the direct face we see on the health system related with the authorities and the population. These are the force in the first line of attack. And we as health systems, we need to guarantee the resources, the training, as Camilo said, but also guaranteeing the fact of availability of resources. Something that maybe doesn't happen during the pandemic, didn't happen during the pandemic, but I will think that these are the pillars, and the most important pillars in our health system are the personnel. The transformation from the healthcare personnel are something that will be a multidimensional phenomena. In our countries with different geographical situations or different situations, we might witness those transformations from the ones that we have experienced. For example, the one from Dr. Mari Carmen witnessed during this super experience of serial malaria. This is a huge transformation that we were able to work in Peru, in the jungle area. So we include not only the health workers, not only the policymakers or the health providers, but from the Ministry of Health and the entire cascade, we guarantee resources, education from the population, for the population from the health staff. And Mari Carmen is a witness, and she has more data than myself. And that was a very important transformation. We were able to reduce malaria from 2016, 75% of prevalence. With this transformation that was led by the health staff, and I would like to highlight this effort, was reduced to less than 20% in the jungle area. And this is something that is available in national data. And this is, of course, a real transformation, a commitment, a real commitment that came from the national policies downwards. It's a, instead of a top-bottom strategy, was a bottom-top strategy that came with education, having the resources and guaranteeing the understanding of the faraway communities. And this is an example on how with very few resources, because we didn't invest too much. We of course wanted to invest more, but with the few resources we have, with the commitment of the health staff, we were able to make some changes. And I think that that's an important accomplishment. To reduce malaria, less than 50% was something that was a fantastic transformation. Other transformations that we were able to conduct that of course were more difficult to obtain. Dr. Mari Carmen established the implementation, the law of healthy feeding. A couple of months ago, we talked with Mari Carmen, and in the little shop in the corner, I listened to a kid that said to the mom, let's not buy XYZ products because it has 3 octagons. Let's buy this one because this one is healthier. So this is something that affects the population directly. It's something that we can do with a lot of sacrifice, but it was possible. So there are some transformations that will move from the middle to the bottom, other transformation that could move from top down, and that will depend on the initiatives. We need to understand that especially the population will need to be aware on the fact that the health is extremely important.
Gracias, doctora. Gracias. Doctor Goji.
I think Dr. Camilo already mentioned some questions that we need to discuss. Yes, thank you so much, and thanks, Silvia, for your comments. The direct question from Camilo on how can we put away some steps is an important opportunity, and will take some efforts. We will take some willingness and cooperation. But for example, we need to keep in mind the failures of the Nordic countries, United States, and the implementation of digital structures. Of course, we have progress in that, but we were able to learn a lot how not to do it. And we need to think about this aspect to know what worked and what didn't work. And we need to take into account that the technology is more connected to the citizens. In the difficulties that we have in the Nordic countries is that the system is quite rigid because it was built almost 2 decades ago. And this is something that we should not repeat. And this is a strategy to overcome some difficulties. It's important to connect the new biology, the genomic, with the systems and clinical records. This is now possible. We are able to work with federal systems, those who are not demanding physical data, but we can do some database gathering. This was not possible 5 years ago. It wasn't possible to think about those aspects 5 years ago, but now it's possible. So we can connect some data without being physically there to install data from one country to the other. That's another aspect. The third part that was mentioned by 3 of you was the training and the health literacy, the understanding of health. Anywhere in the world, we pay enough attention to training when we implement new technologies. And if we can put this at the same time, we will be able to jump very quickly. But we need to connect those elements. And as was mentioned before by my two colleagues, we need to connect the idea of the outcome. What do we need to obtain the health systems? Looking how to strengthen the primary healthcare. What do we need? Before thinking about technology, it's extremely important to think about what we need to overcome, what we need to obtain, and that's the failure. Focus our attention on the structure instead of the problem. Not only buy and implement a system, that's a technical aspect, and that's what we need to think about. Not what system to buy, but what can we do with the system, and that's something that will increase the value of our approaches. So the concrete response on what steps can we avoid? The first step will not be, wouldn't be what tool to choose, but what is the objective to attain, to accomplish. The second step is how, what technology can we use, and that's an initial blueprint or initial map to move forward. And I think that Latin America could be benefit from those of some of these steps, and we will have a population as big as the Spanish-speaking communities we have in Latin America will be a very important common goal. Every country is trying to implement a digital technology that will allow us to implement in the different geographies that we have to deal with in Latin America. So why can we collaborate with each other? We need to manage some data, the data governance, and that's something similar in our countries, and we can collaborate to escalate those numbers, those figures. And we all need to see health as an investment, and that's something that we need to connect with. So if we can collaborate with some concept and escalate with ideas or strategies using the disciplines between the countries, I think that we can we can implement the idea from Camilo of moving some steps to one side. So how come prioritize the health? Prioritize health instead of disease. Well, first of all, we need to create schools of public health that are robust, that will be approaching this domain. It goes through the extent that in this moment the public policies are interdisciplinary, and the vision that we have on the process of health priorities might be the first line attending to the demand, and should have also a different view. I, as a health economist, might say that I took some years to realize that some of the schemes that I learned in my economy classes were not that useful to analyze the health systems because it wasn't manifest as an offer and demand, but we have a lot of different aspects to take into account, and we need to approach differently. So those aspects need to be incorporated in the training of our healthcare professionals or the policymakers in the economy, in medicine, in nursing, and the people and teams that will be part of these strategies. And it's important to consider the training in public health.
como algo tan cotidiano, pero que a veces aparece como distante, ¿no? O sea, nunca antes, de nuevo, la salud pública había sido algo de todos los días. Todos los
Never
días
before, public health was something
cómo va la pandemia,
was
cuáles son las
something
medidas que se
so
toman, cómo se van a
on
evitar,
the mainstream.
qué sé yo, los
What are
casos
the
de
measures to prevent the extension of the pandemic? Every day reporting on how many deaths or how many new cases were detected. Public health is not a place or an institution. Public health is everyone involved in keeping people healthy to avoid diseases and the burden of disease in more people.
Doctor Boyi, bueno, nos
So
faltan
for
algunas
Dr.
preguntas,
Boji,
vamos a
there are
iniciar con
some
esta.
questions. I will try to
Ujú.
prioritize them.
Instituto, ¿cuál es el enfoque de salud
What is
global
the approach of
del
global
instituto que dirige?
institute
¿Cuáles
or
son
the
los,
institute you lead?
principales aliados de su
What are the
proyecto
main
en
allies
Latinoamérica?
on your projects in Latin
¿Cuáles son los
America?
principales
What
retos
are
y
the main challenges
oportunidades
and
para
opportunities
lograr su escalabilidad en sus
to
países?
provide that scalability on our countries?
Gracias, gracias. Em, en nuestro enfoque global,
But in our global approach,
el instituto es una
the institute is
un instituto sin lucro,
the institute
no
without
afiliado políticamente. No es público, no es privado. Estamos
economical
trabajando
interest. It's not a
para
private
mejorar
institution. It's
en
working
la sociedad.
to improve the
Y
decision-making process in the
hemos
society.
tomado una
And in
posición
health, we
que
took
la
you
forma
took a
de
decision
la
of
salud globalmente
having
no es
health
sostenible.
globally is non-sustainable.
Y por eso enfocamos
That's
en
why
trabajar
we
con partners, con
work
organizaciones,
with
con
partners, with
sistemas
organizations, with
y también
systems
empresas que quieren
and
acelerar
companies
un
that
cambio
wanted to push
en este
forward
ámbito.
this change.
El método que usamos más frecuente
The method that we use more frequently
multi-stakeholders, que se
is the multi-stakeholders
para
approach
intentar levantar una
that
cuestión
work with
hacia
many,
frente.
trying to
Y
present a question and work towards the future.
cuando vamos a
And
un
when we
país
go to a country, it's extremely important for us to work together with the experts,
tomadores de
with the
decisiones,
decision makers,
organizaciones
with the different organizations that are there and understand
nuestra
the
prioridad
system
no es estar
from the
trabajando
inside,
en un país para tomar una posición ahí, pero solamente para poder apoyar
not
decisiones
only to be there in order to
con nuestras
make a decision,
competencias
but to contribute with our knowledge, with our strength, with our experiences and strengthening. And when
parte
already
y ir a otro país
is done, we can move to the next country to keep working. Of course,
y participar
we need to be connected and
porque
have the participation
desarrollando salud no tiene un fin. Siempre vamos a querer
of
más.
the locals, and of course, keeping in mind that health is not
Esto dicho,
something that you might reach an objective and that's it.
empujamos esos cuatro
Health is
pilares
always
que fueron
in the process of improving. We push those pillars.
se podría tener
For
otros,
us,
podría tener
that might have 8 or 3 or having other aspects that we decided
porque podemos
under this concept.
y ahí se puede también priorizar
Possibility of prioritizing
dirigía la nueva
the decision
data digital,
making process into the
pero también
inclusion of biology,
se puede el cuello de botella en
avoiding
todo
the
todos los
bottlenecks
países, no
that are
importa
present
si
in
tú pobre o rico,
almost every country.
que no
Doesn't matter if you are rich or poor. If you don't have a
ir a
digital infrastructure, you're not going to be able
la parte
to go to the front, and that's why
la parte
we are working a lot to democratize the digital
mejorar
domains,
hospitales
not only to improve the hospitals, but also
para
improve the access
para todos,
for everyone.
mayor parte de la población en este formato. Y esta forma de trabajar también estamos
This way of working that we are following a model in Latin America,
hay en el enfoque digital
we have the digital approach that is quite present there.
también hay focos específicos
And we also have specific
lista de espera,
approaches in terms of the waiting list that many times
por una
are
falta
caused by a lack of interoperability
transparencia
and transparency
datos, así que se
in the
puede
data management so we can connect it.
interoperabilidad
There is an interoperability in general terms in the systems, but also is present in almost every country. The data governance, how are going to be able to manage the data that are reliable to have access to. There are many differences between countries, and of course, the problematic that we see is that we change a lot of political approaches or political wings from right to left, and the systems needs to establish objectives independent from the government. That's why we always pushed without difference, the thinking beyond policies. But center in that concept, we have health as an investment, not as an investment, not as a cost. And health is the most important dynamic for equity, more important for the development, and most important for growing. Another element that has to be mentioned, as Camilo said as well, an approach that we have is to see within the systems, because we know, I don't know if the misuse or the misexpenditure, but the lack of the unwisely use of resources is one of the Achilles heels of the most frequently detected Achilles heel of the systems. So we need to detect those mistakes before putting more efforts on something that is not working properly, and will be a waste of time. I'm not saying that we should not need more budget. Of course, we need the most of it, but I will say that this is not the solution that will solve it all. We also need to improve the systems. I don't know if I answer all the questions that were presented to me. Thank you, Dr. Boyi. Dr. Camilo, a couple of questions before we finish. In front of the slow economical growth, what are the opportunities we have to protect the health of the populations? The second will be, what was your biggest challenge in the public sector in Chile that was overcome during the last years, and what are the lessons learned from those situations? Well, regarding the first question, I might say that countries will need new taxing agreements that will be located in the context of this economical speed reduction, and those are aspects that should be taken into account, supported by a huge participation from the citizens.
Debiera dar como resultado, a mi juicio, que se priorice políticas sociales, ¿cierto? En particular salud, porque en el entendimiento
might give public policies in health in order to recover the pre-pandemic situation. That's a very short answer to following to the next topic. And the second question was about the Chilean experience. I might say that in the last years, one of the most successful policies of Chile was the massive vaccination in speed and extension. And that's something that's based on the historical primary healthcare strategies and the vaccination successful programs that we have in our country.
Que en Chile tienen una representación institucional muy importante en el Ministerio de Salud y que están desplegados en todo el primer nivel de atención, ¿no? Y eso yo creo que facilitó mucho que hubiese
the experience of vaccination in the installed capacity provide the prerequisites to have that access to a successful study. And also the social revolution that we have in October of 2019, you opened several paths of discussions. You are creating now a new constitution in Chile, And for health was important because open the path for making feasible a health revolution that is in plain development. The current government is allowing for FONASA to participate into the health reform.
Muchas gracias, doctor Camilo. Y
Thank you so much, Dr. Camilo. And just to wrap up, maybe a last reflection or comment.
podemos transformar los sistemas de salud sin
Can we transform the health system without
garantes de los derechos
having
algunos que puedan.
guarantees for the
Adelante, doctor Goji.
basic health
Si
rights?
entendí la pregunta bien,
Well, I don't know if I understood the question, but if we can change
salud sin
health
garantizar
without guaranteeing
Algo así.
rights, basic rights, is that that's so?
yo creo que se
Well,
necesita
I might say that we need
más
rights and
enfoques en
emphasize
pero esto no lo hace solo.
these as approaches, but this is not something that can be done by itself because we have
Internacionales
different international treaties and many documents,
¿no?
policy documents in many countries.
Necesitamos también
And we
pensar,
also
admitir,
need to think and admit that
esperanza de que
our hope
niveles de servicios de salud
in terms of what level of health or what level of health
deberemos
it's
tener
available
en la vida, eso se cambia.
might change
Que fue aceptado en la mayoría de los países 30 años
because it was accepted 30 years ago.
¿no?
Is not longer accepted. It's something that is developed when years go by. It's something that,
Por eso de tener los derechos tampoco son
and of course, the rights are not static as well. It's something that needs to be adopted, and that's something that society, the civil society, needs to take with responsibility.
Eso no viene de nada. Viene
This
porque queremos
comes
trabajamos juntos.
by the common work with the civil society and the authorities, and the request from the civil society
Adelantado, lo que estamos
should
sirviendo.
be moving forward in a constant evolution. We always need to push the limits, but to have a sustainable health, the government will not be able to give everything that is requested. We will need to have access in a sustainable manner, to think about what are the resources that you invest and what are the values that came out of it. And this is something that has to give you a positive result. That is the way of thinking, and this is something that came part of the economy of the well-being. It's not a solution for everything, but it's a part of it. So to conclude, it's not only the guaranteeing of resources, but pushing the envelope.
Doctor Roger, ¿algún comentario?
Thank you, Dr. Boyeris. Any comment, Dr. Camilo? Yes, I just wanted to agree with Dr. Boji. It's important to recognize that the process of changes is a process. Just to give you an example, in the Constitution of Chile, we have the right to choose. It was fundamental to have that right in health. So the Chilean will have the possibility to select between a public and a private access to health. And I see that many constitutions say that they have the rights, but the countries are not able to make it happen. But this is something that was there from the constitution, the right of access to health and to select the system that they prefer or are able to have access to. And this, of course, needs to be sustainable. Transformation needs to be sustainable, presenting the sustainability issue, sustainability in time. And I'm not talking about the fact that I'm convinced that the topics or the changes that we need are at the same time sustainable and more efficient. Thank you. Thank you so much, Dr. Boji, Dr. Camilo. We really appreciate the participants for sending their questions. Unfortunately, we're not able to answer them all, but we will take into account to organize the following webinars. We thank you very much for your interest and participation. So to close this Q&A session, I would like to ask you to summarize the last minute message or your lesson learned, the challenges that we have. We're starting by Dr. Boji. So I would like to ask you all that you are using the time to improve the health. You are the heroes in our societies. And you might think, what can you do with a small change? It hasn't had to be an extreme change or a revolutionary change, but a small step that little by little will go towards that huge revolution that we all need towards a better health for our communities. Well, I just wanted to thank you for the invitation. It was a quite interesting debate. These elements of the new biology data and technology available will help us to make that jump, to incorporate the new decision making in the process of transformation. Thank you so much.
Gracias.
Reiteramos el agradecimiento a nuestros excelentes
I'd like
ponentes.
to thank you, Dr. Goji, Dr. Silvia, Dr. Camilo Cid, to every participant that week after week join us, Dr. from Horas, Cono, and everyone that participated in this activity that was possible thanks to the Andean integration and the Latin American integration. Now I would like to leave the word for María del Carmen Calle on behalf of the Andean Organization of Health, Hipólito Unanue Agreement. I would like to thank you all having connected so many people. We were more than 400 people in our social media with many questions that unfortunately were not answers because unfortunately due to time constraints we were unable to answer them all. So I think it was a quite interesting webinar. We were able to learn a lot, but this is not the end of it. This is the first step, and that's one of the duties of the Andean Organization of Health. The three pillars, including the accountability pillar that Silvia suggested, are quite important to be incorporated. I really love to listen to Camilo talking about the primary healthcare attention as a strategy, because it was always the discussion with Chile. Primary healthcare is a strategy, is not the first level of attention. But after listening to Camilo, I think that we will talk about or we'll repeat the topic in the future. In the primary care with specialization, that you have access to these healthcare services that will solve your daily problems. The next topic that was taught by data, it is the world trend now, the world topic. And I think that very important topics came out of this meeting. First of all, yes, we have infrastructure, we have possibilities of having more information, we have possibilities of moving forward. We have countries in different levels of development. But one thing that will be a request from all of us is the demand of training. And this, as we hear during the webinar, are only tools. The tools by themselves will not solve the issues. Living longer, but living healthier. I think that was the main message that I really love. In Spain, they live more than in Nordic countries, but we need to take into account the quality of life as well. And the topic health, I'm completely in agreement with that because we just defended in the integration system of health. We believe that health is a fundamental axis for restoration of the development. And we will continue working to keep it in the middle of the policies because it's quite easy to move them away. All the organizations are talking about health right now. And I really love what Camilo said. We are always looking for the news that we have in the something that never happened for this pandemic. We cannot forget how important health is in our daily lives. Being convinced that health is an investment. And there's where we will push the position of health in the mindset of people. I believe in the training of digital transformation that if you don't start by the priorities of validating
medio, ¿no? Para poder
worth
lograr
health
calidad de vida,
to accomplish well-being, it's not enough the training. And that's something that we need to agree with Sylvia. I don't really like the word sensitize, but make awareness or be aware of that people is aware that health is a fundamental requirement for development and well-being. But this is something that has to be translated into budget. And of course, our countries, we were not able to reach the proper objectives or the proper budget. And of course, we have the quality of expense, corruption, and transparency. And I think that the accountability topic will be fundamental there. Another aspect that was mentioned as well and start by step at the local effort. Regional for us is subnational because sometimes we are confused. There are local levels and subnational level where we can do a lot of things. And our countries might have good practices. There are very good things that work properly that we weren't able to escalate them, maybe due to the fact that we are not not similar countries, but we are countries within countries. And there are some countries that have more difference than others. For example, thinking about Chile, Ecuador, and Bolivia, with all the differences we have, is extremely complicated. But I think that this meeting was quite important because it opened our eyes towards the fact that we have to think about in the long term. It's not a 1 year or 2 year effort. We need to think, as Sylvia mentioned, the long-term plans. And it's extremely important that the new governments take the best of the previous government and not starting from zero, not starting from scratch, but pushing forward that car, having the possibility of having access to health by everyone. Thank you so much, Goya. Thank you so much, Camilo, Silvia. So thank you so much, everyone, for being with us today. We see you next Thursday. I would like to take this opportunity to send my regards to nurses for their International Day. I think that we're extremely important during the pandemic, and they are always important, not only during pandemic, but they are constantly working. And right now, during the vaccination strategy, they were a fundamental pillar. Have a wonderful day, and thank you. See you next Thursday at 11 a.m. See you soon. Bye-bye.
Tiempo los dos.
Muchísimas gracias.
Hasta luego. Chao, chao.
Hasta luego.
Chao, hasta luego.